Contaminated water and poor hygiene are closely linked to the transmission of diseases in Pakistan such as cholera, dysentery, diarrhea, and typhoid. 88% of the deaths can be attributed to poor and unsafe hygiene. Waterborne diseases are common in Pakistan with 3 million people suffering annually.
40 years back लाहौर में लोग पानी उबाल के पीते थे. Ask your mother, पानी उबाला, मलमल के कपड़े में छाना और पी लिया. वो ड्रिंकेबल था, आर्सेनिक नहीं था. अब समझिए आर्सेनिक. हमारा प्रॉब्लम ये हो गया कि अब इतना ज्यादा गटर्स और ये जो जब ये रोड रिपेयर करते हैं ना, व्हाट दे डू इज कि ये चेक भी करते हैं कि पानी की लाइन वहाँ कहाँ जा रही है, और जल्दी वो इतनी लो रख देते हैं अपनी सीवरेज लाइन के, वो फट कर आप पानी के साथ मिल जाते हैं और लोगों को पता ही नहीं चलता कि घर में कितना गंदा पानी आ रहा है.
Well, in the developing world, main bulk of diseases are caused by contaminated. I wish we could raise the awareness regarding this. All the infective diseases which infect the gastrointestinal tract and also which penetrate the gastrointestinal tract and then infect other organs like hepatitis, all gastroenteritis, diarrhea, dysentery, many other bacterial infections, amoebic infections. I mean, a whole bunch of diseases which are caused by contaminated water.
What kind of a disease is typhoid?
Typhoid, again, it's a very severe disease caused by a gram-negative, we classify that organism, it's a bacteria, gram-negative bacilli, and it's foodborne.
So
It causes fever and lots of complications like perforation, all other complications. It was fatal almost quite a long time ago, but then we have got effective drugs now.
Alright, so are there specific areas where typhoid is more common?
Where there is no safe drinking water, all the areas, all are rural areas, places
Right.
where
So the
there's
main reason is contaminated.
certainly with flies, with contaminated water, poor hygiene, decreased bathing and washing of hands. Also,
How many patients do you diagnose with typhoid every year?
typhoid has decreased because we've got effective drugs. And now even people who come with mild symptoms, GPs give them a lot of drugs. So that's why it's decreased. And that's why we're getting more drug resistance also. And somehow the media is there. There is still awareness that at least if you can't have a clean water, boil the water before you drink. So there's awareness to that extent.
In terms of hygiene, does it affect their future in any way?
Definitely, childhood is the period in which the children grow rapidly, not only physically but also the mentally. So this is a period where the growth and development go hand by hand. So if the child is being affected by these infections in the form of the diarrhea or respiratory tract infection, any of the disease which occur recurrent form, it affects their development as well. And not only the development but also affects their school attendance, their physical activity, and their performance among the other children. So definitely a child who suffers from the recurrent infection is unable to attend the school and he is unable to perform like his other siblings or other classmates.
Other than that, in your opinion, how fatal are these diseases and till what age do these prolong?
Definitely many of the diseases are very fatal. Amongst them, the diarrhea is considered the third most common cause of mortality in the third world countries, and it causes about more than 500,000 deaths per year, and probably in the 2017 it affected more than 20 million children around the world. Among the other diseases like typhoid fever, it has the mortality rate of 10 to 30% if it remains untreated. Then hepatitis A, which affects more than 5% of the children mortality if it is remain untreated. So these are the diseases which not affects the children in the form of the death, but also affects their families as well.
Through our research, we discovered that restaurants are a significant cause for the spread of diseases. What precautionary measures do you think are necessary for maintaining a hygienic restaurant?
There are so many precautions that are very important for healthy restaurants. Number one, sanitizing the area where food are preparing Number 2, workers should wear cooking hats, gloves, masks, and aprons. Number 3, food quality must be checked periodically.
So, why do you think most restaurant owners neglect hygiene?
First of all, I would like to say that the best food prepared without germs, that is in your home. And public should consider the hygienic food before choosing the restaurants. That is what I want to say to the public.
After we realized the situation of our country, we wanted to compare it with foreign countries.
So sir, what's the fatality ratio of such diseases?
So, Daud is your name, right? So, Daud, fatality ratio is referred to as mortality in medicine. Okay. Now, mortality ratio usually is very variable in every different country. Even within a country, if you look at certain areas which are poor and certain areas that are rich, urban versus rural, access to cleaner water or not, education or not, background, social. So, mortality is very, very variable. Okay. But every year the mortality changes. Okay, so every year the government publish their data. If you compare to UK or Ireland, then the mortality is almost negligible here when it comes to these diseases, because these diseases are not found. Only 9 cases of cholera were reported in Ireland in 2009, and UK websites say that this doesn't exist here. Only when people travel to the pandemic areas can they bring back, but otherwise these diseases are very rare. Now, if we talk about Pakistan, the mortality or the fatality ratio in Pakistan in an untreated patient is 10 to 30%. So unless proper care is given, 10 to 30% patients would die. And if proper treatment is given, then that is reduced to 1% treatment.
Would you like to add anything else about how to prevent these diseases, how to raise awareness about the topic?
But it's a very simple and effective tool is to improve the hygiene. And this not only helps in the hygiene, in the prevention of the disease in the children, but also in the parents as well. So I would stress that the hygiene and sanitation and the good drinking water availability must be facilitated.
We haven't invested in infrastructure. Rural areas, villages are very dirty. Look at the drains, it's all open. People defecate in the fields still. You should have lavatories. People shouldn't go to the fields to defecate for the call of nature. So to decrease the contamination of the excreta with the drinking, decrease pollution. There's so many flyers, open vendors, all eatables, dahi ballas, chana, cholas, ice creams.